Campbell. I'm a student nurse here at the University of South Alabama, and today I'm going to be inserting an enema. Here's my ID. I'll now scan the room. I'm going to place my phone. And so I'd first just start this procedure. I'm grabbing my order form right here. I'd start this procedure by checking the hospital policy and the order. So here we have an order for a soap suds enema on the arrival to floor. So now I'm going to go ahead and identify my patient using two identifiers. Here we have Jaguar Jones, medical record number 4176352, medical record number 4176352. And I do note an allergy to penicillin both here on his wristband and on his chart. So I'm going to move this out of the way. And I'm going to go ahead and verbalize that today this chair will be my IV pole and that this picture will be my bedpan, making sure that the wider portion of the bedpan goes under the buttocks and the narrow portion points towards the feet. So now I would tell Miss Jones, I am going to be inserting an enema today, and I'm just letting you know what procedure we're about to begin. And so then I'd provide Miss Jones with as much privacy as possible, shutting any doors or curtains. And so now I would gather all of my materials, which I have right here, and then I would remove my glasses, but I'm going to apply goggles and perform hand hygiene. So now I'm going to take my enema bag and my Castile soap over to my sink, and I'm going to fill my enema bag with 750 milliliters to 1,000 milliliters of warm water or normal saline for an adult. And so I'm going to go ahead and add my Castile soap and dispose of that, and then gently agitate the bag. And then I'm going to go ahead and prime my tubing. And then I will go ahead and go back over to my work area, but I am going to remove this so you have an unobstructed view. And so I'm going to hang my bag here on my IV pole. And now I'm going to go ahead and apply clean gloves. Raise the bed to an appropriate working height, lower the side rails, and I will go ahead and position the patient in left lateral Sims position, but I'm not going to do that today, so you will have a view of me inserting the enema. I'm now just going to place down the water-resistant barrier under the patient's buttocks, and I'm going to go ahead and grab my tubing with my dominant hand, which is my right hand. I'm going to remove my cap. I'm going to make sure and lubricate this tubing really well and even get up in there with my non-dominant left hand and make sure it's just nice and lubricated. And so Miss Jones, I'm about to insert the enema, and it would be very helpful if you could take very slow, deep breaths. And so I'm going to spread the butt cheeks apart and then insert the enema 3 to 4 inches. And then I would unclamp it and grab my bag and hold it 12 to 18 inches above the patient. And I would like to note that if the patient had hemorrhoids, I would have them bear down upon insertion. And if this caused any cramping, I would lower discomfort, I would lower the bag so it would infuse at a slower rate. And so now I'm going to verbalize that my bag is now empty, and I'm going to go ahead and remove the enema, dispose of it properly, then grab my bedpan, or if my patient is able to go to the toilet, I would assist them to the commode. And so again, the bedpan, the wider end is under the patient's butt, and the narrow end points towards the feet. And so Ms. Jones, I would encourage you to hold it for 10 to 15 minutes and then go to the restroom. And so now I would clean up my mess, and I would remove my gloves, remove my goggles, perform hand hygiene, and I would document. And so I would document the patient's, I would document how the patient handled the procedure and how I left them. I would document that I used a 750 milliliter soap suds enema. I would document the amount and color of the return of the enema, and I would document the time that I gave the enema. And that completes my video.